Good evening, everyone. I hope that I am audible and you all can see me. The World Zatushi Chamber of Commerce takes great pleasure in inviting you this evening on a small webinar on COVID, coping with COVID and lockdown blues. In March, our lives as we knew it, all these years changed 365 degrees to in a completely different direction. No one in our lifetime has seen such a situation as we have today. The way we do not know how this will end, we do not know where this will go, but our lives have changed forever, that is for sure. Ever since the lockdown has started, we have been cooped up in our homes, not going to work. We have the most technology averse person has to now rely completely on technology to go by his daily life. Social interaction has reduced to a minimum. Jobs are at stake. Businesses are going down. Most of us are worried how we will make the next payroll of our employees. The conscience weighs heavy on our hearts. We are nowhere near the end of this pandemic as well. People are saying the worst is still to come. We don't know. There seems to be no cure, no vaccine, nothing. All we have is hope. And in these times, one has to learn to adapt to the situation and hope for a better future. Also, with these kind of webinars and calling in experts, it helps us greatly in our day-to-day life and to cope with the challenges. Towards the same, it is my greatest pleasure and honor to welcome an old friend of mine, Dr. Zirak, eminent child and adolescent psychiatrist, who will be hosting this evening's webinar. I would like to give a brief introduction of him before I hand over the floor to him. He's a renowned child and adolescent psychiatrist and psychotherapist with clinical training at the Westchester Medical Center, New York University. He is also a youth mental health first aider accredited by the Mental Health First Aid in Australia. He has had over 18 years of experience with educational psychology and guiding children with learning disabilities, developmental delays, autism, and emotional, behavioral, and psychological problems. Currently, his work profile includes being the medical director of the Aditya Birla Integrated School for Children with Learning Disabilities and Psychological Emotional Problems. The school has been ranked first in Maharashtra and Mumbai and first in India by Education World over the last 4 years. He is an advisor and senior psychiatrist for Empower, which is a holistic medical center of excellence with a multidisciplinary team of professionals providing services and therapeutic interventions for children, young people, and their families with mental health concerns and neurodevelopmental disorders. Empower also advocates outreach and awareness campaigns to stamp out stigma against mental health. He has authored the book, Parenting in the Age of Anxiety, which is a unique publication covering topics such as bullying, abuse, adoption, academic stress, disabilities, and death, amongst other hard-hitting parental concerns. He has consulted for various schools in Mumbai, which include Hill Springs International, JBCN Group of Schools, Aditya Birla World Academy, Manu Prem School, and A.K. Munshi Yojana. He has been a consultant at the Saifi Hospital and with previous attachments to the Breach Candy Hospital, St. Elizabeth's Hospital, and Children's Hospital. He has conducted innumerable workshops, trained and given lectures to the students, teachers, parents, and other professionals in Mumbai and across the country. He has published many articles for newspapers, magazines, and the media. He has had many recognitions, including being felicitated by the Mancherji Edalji Joshi Memorial Trust and awarded the Times Education Icon. Also, the Zoroastrian Trust Funds of India has awarded him for his outstanding contribution in the field of education. He has received the Quality Leadership Award, Healthcare Section by World Quality Congress. In 2019, he was awarded the 50 top global mental health leaders by the World Mental Health Congress and Healthcare Leaders. In 2020, he was awarded the XYZ ACE Award for his contribution to mental health and education. It is with great pleasure, therefore, that I welcome him on board today. I would request all of you all to kindly share your Q&As on the Q&A icon later on, and I will post the session, read them out to Zirak for his perusal. Over to you, Zirak. Welcome, and over to you. Thank you so much.
Thank you, Zoxis. God, that was very long. I was hoping you would edit that.
No. The people need to know how good you are.
Anyways, thank you. It's a pleasure for me to be here today. I know that some of us are even, done with webinars and seminars, and I promise to make it as short and crisp as possible, and yet cover all the relevant points. Yeah. So, of course, I've been asked to cover a few points. So today I will be talking about as to why we are heading towards a mental health crisis. And I think that's not just in our city or country, but I think it's all over the world. I'll be also talking about what are the warning signs that we need to be cognizant of in order to seek professional help with mental health. Also strategies to safeguard families, individuals, and also understanding teenagers. I really believe that of all of us, our kids, the younger ones, especially in the age groups of 6 or 8 or 9, are our heroes because they've been so resilient and remarkable in adapting and adjusting to this situation. And some of them, like my own 2 kids, just feel that they are on an extended holiday right now. So they are truly the heroes of the COVID-19 pandemic right now. But teenagers, however, are going through their own crises because of this, and we'll discuss why. And of course, towards the end, we'll discuss strategies, basic 7 strategies to kind of protect our own mental health. So when you look at where we are heading and why we are heading, like Zoxis rightly said, I think the biggest point of contention is uncertainty. Now, if you really understand where subconscious reasons start from, which cause or create anxiety, it's always been the fear of the unknown. So for example, if you remember our school days and giving exams, we didn't know what questions would be asked or what question papers would come by, or anything of the future which is uncertain. Anything that has uncertainty with no real answers can give setbacks and feelings of anxiety, right? And that's exactly what this pandemic is. We don't know what the future holds. We don't know what the treatment protocols are going to be, if there is going to be a vaccine or not, the lockdown situation. And there are so many, unanswered questions. Like even, for example, still we don't know that if one of us or our loved ones get afflicted by this virus, what happens really next? Who will come and do our blood test? Is the BMC going to intervene? Are we going to be in which quarantine setup or center? And there are so many, like I said, unanswered questions, even uncertainties about our jobs, financial insecurities, the markets are on the low right now. So all this is going to create naturally uncertainty and anxiety for sure. So whether we block it out, whether we kind of take each day as it comes, it is subconsciously playing on each of our minds to create what we call as unknown stress. Also, with the lockdown and all that we've gone through in 2 and 3 months' time, there is a sense of confinement, right? I mean, out of sheer fear and of course, collective responsibility means we are in cognizance of being at home to safeguard ourselves, our families, and our loved ones, right? So yet, however, we process that and we believe that there is a huge sense of frustration, boredom, isolation, and of course, with no real outlet, with no real physical outlet, there is a sense of irritation, moodiness, and loneliness that definitely sets in. And of course, some of us don't even have the privacy of our own rooms and spaces. I mean, I know how people are struggling at home to even work. I mean, I know so many young adults who are starting out in their careers and their lives. They don't have space at home to work, and it's getting more and more impossible because so many families live with grandparents, or there are joint family setups and there are kids at home. There is no privacy. In fact, what is even so heartbreaking to know is that as we are saying that mental health is on the rise, can you believe that the number of consultations have come down? Which is so interesting, right? One would assume that with so much of more awareness on mental health and depression, people would reach out more. The numbers have actually dropped. And there are two main reasons for this. One is obviously the financial insecurity. So that, people are not even prioritizing mental health right now. And that is because they don't have the resources or the funds, or they are out of jobs. So there is financial insecurity. So they don't want to prioritize mental health at this point. And secondly, even though if that is not the problem, there is no privacy because we are relying on technology. And recently also I had a consult with there was a marriage that was, in an upheave, and I was counseling the wife. The husband, pressed his ear against the bedroom door, overheard the whole consultation, and at bedtime and at nighttime, he completely, lost control and he became abusive again. So privacy is a huge issue why people are not even, reaching out for mental health when they know they need it. So this just gives you a window into the frustrations that are building up in families that are perhaps already in strife. Also, what is happening as to why mental health could become a crisis in the future is people who already have existing mental health concerns, whether it's depression, anxiety, panic attacks, or even OCD or claustrophobia, or even just constant or consistent stress. They obviously, because of these factors and reasons, are unable to reach out perhaps, or they don't have access to medications. Prescriptions are becoming a problem through doctors. Chemists are not really being open-minded about helping out in situations like this. So obviously, existing mental health concerns have also increased. Thirdly, I would say that because of this confinement and all these above factors that I just mentioned, abuse has gone up tremendously. I cannot tell you the number of SOS phone calls that NGOs and helplines are getting for, spousal abuse. There is abuse on children because a lot of frustrations are coming out onto the children, and children are being physically or verbally abused. There is an increase in marital discord and relationships at this time. Anyways, existing stress between, in-laws, or, between the mother-in-law and daughter-in-law, those stressors have completely flared up. Another reason why mental health is on the rise is because of this frustration, boredom, isolation, and restrictions at home. Addictions have gone up. So there are teenagers who are literally addicted to Coca-Cola. They are using rated drinks and finishing off 1 or 2 liters a day of either Coke or Sprite or other kind of aerated drinks. Cigarettes, alcohol has gone up. Alcoholism and alcohol abuse has gone up. And sadly, even substance abuse. I mean, one would think that in a lockdown like this, drug dealers and drug abuse would, come down. It's actually the reverse. There are so many teenagers who still have access to drugs, especially marijuana, and are abusing the same. Then comes the whole financial burden, the financial insecurity, the job insecurity. So that's also playing out a huge role with the mental health crisis. And of course, lastly, the whole balance, right? Like I started off saying, the whole balance of working from home. So many of us don't have staff members, whether it's cooks at home or people who come and clean us, our drivers are not there. So balancing, home chores, work, there's so many parents who have kids at home. Our children are going through online schooling, which is not easy again, because, we are grappling with technology, and our kids have to be online and supervised perhaps for 4 to 5 hours a day. Now imagine when you're balancing your own job, your own work, the home chores and the cooking and the cleaning, and then you're looking after and supervising your children with their school life. It is virtually impossible then to sometimes look after your own self. So the whole balance has right now, gone off. And that's also leading to a lot of stress and struggles with regards to mental health. So these are, like I said, all the rationales and the reasons why mental health is on the rise and will continue being on the rise. And I think globally, they are expecting that mental health will soon reach a crisis proportion. And this is not just with us, it's even something that the WHO is talking about at this point. Now coming to the warning signs, right? So when you know these are the existing stressful triggering factors, one has to be very, very careful that the symptoms don't persist and remain, right? I mean, all of us go through our ups and downs. We all go through low days. We all go through, sometimes feeling like we're on a slump, or, difficulty with sleeping patterns or eating patterns and things like that, right? But when does one have to seek help is when the symptoms remain and persist or increase. So what are these symptoms? First, I would like to talk about what clinical depression looks like, right? So if you or your loved one is going through persistent low or irritable moods, or constantly feeling sad for no reason at all, if there is a complete lack and loss of interest in almost everything, so even like, just getting up in the morning and getting dressed, going for a shower, or going down for a walk perhaps, or putting on the television and watching your favorite TV program, or watching sports, or interacting with loved ones, there is a complete dip or a loss, like I said, in interest in all these activities. Then comes a lot of negative thoughts. So no matter how you try and block off certain thoughts, there is a constant loop of negative, worrying thoughts, and a complete sense of helplessness, hopelessness, and worthlessness that sets in. Sometimes with depression, one may even have suicidal ideas and thoughts. We all get thoughts about sometimes wanting to just end things, end our lives, hurt ourselves. And then these thoughts keep festering in our minds. Or changes in sleeping patterns and eating patterns. So either excess sleeping and lots of sleep where you're unable to wake up. And I know so many people who go through depression are sleeping for about 10 or 15 hours a day. Or there is a lack of it where people don't get sleep at all and they barely manage with 3 to 4 hours of sleep a day. And also, a complete sense of helplessness, hopelessness, and worthlessness. So these are all, like I said, clinical signs and symptoms of depression. And if they do not seem to go away and they persist for 3 or 4 weeks at a stretch, almost every day, please understand these are neurochemical imbalances in the brain. There is a neurochemical in the brain called serotonin, which sometimes gets dysregulated or imbalanced when there is undue stress. And these imbalances in the brain neurochemically cause all these signs and symptoms of clinical depression. That's why I use the word clinical. And this requires then obviously treatment by a mental health professional and a psychiatrist, and sometimes even with medication that can really, really help. The second thing, entity, what one must kind of be cognizant of is symptoms of anxiety. So when there's a constant sense again of restlessness, constantly feeling on edge, like there's an impending doom going to happen, or sometimes there is breathlessness, palpitations because the heart rate goes up, sweating. If this accelerates, it can go into peaks and spikes, which are called as panic attacks or anxiety attacks, where sometimes the symptoms almost mimic a cardiac arrest or a kind of a cardiac manifestation, right? There is breathlessness, there's a cold sweat, sometimes there is blurring of vision, there could be dizziness, unable to breathe. And of course, these can, like I said, peak into episodes of panic attacks. So when you are experiencing these, of course, I would say 80 to 90% of clients and sometimes even young adults assume that this is something cardiac based and reach out to a professional cardiologist or doctor. Of course, after ruling out all the underlying tests, it kind of attributes to anxiety. Anxiety is also very, very neurophysiological and needs intervention through medication and counseling. So these are the two main mental health kind of red flags or warning signs. Also, if there are feelings of being unable to just function, there's also a condition called OCD, which is obsessive compulsive disorder, where there are constant, repetitive, intrusive thoughts that go on in someone's mind, and they can't seem to be controlled, blocked, or stopped. A lot of clients who already have OCD, their symptoms have flared up naturally, because if you have an obsession about germs, about hygiene, about contracting an illness, this can completely trigger off another bout of OCD symptoms, which can also be managed well with intervention, counseling, as well as medication, right? So these are the, like I said, the signs and symptoms that one needs to be aware of. One needs to take into cognizance that if these continue and they're not controllable, please reach out for help. Now coming to the youth, right? So teenagers also, like I said, are going through a lot of stress. You see, for them, they are caught at crossroads. They anyways are going through their own hormonal changes, a whole lot of changes in themselves because they're trying to ascertain their own identity. They are anyways going through a lot of problems with regards to wanting their independence and autonomy. They are searching right now through their identity. There's a lot of introspection and reflection going on in their minds. So there's naturally a lot of questioning. Now, when that happens, teenagers being teenagers are sometimes constantly in a kind of conflict with their own parents, whether it's to take part and participate in the home chores, help out at home. There's a lot of online presence. So there's almost like addictiveness and addictions towards social media, whether it's Facebook, Instagram, Twitter, all these. And that heightened with using online platforms for schooling and for education. I know teenagers who sometimes are literally in front of the screen for about 8 to 12 hours a day at a stretch. Now imagine when you're all the time online and you're giving your brain that kind of audio visual stimulation all the time. Imagine the impact that it can have on health. Also, there is naturally peer pressure. So like I said, the addictions have gone up. Even with gaming, there are tons of kids who are playing all sorts of online gaming with other kids online, and they're doing it for 6 or 8 hours at a stretch, and it's leading to a lot of problems and issues with their health. Now imagine all of this, they are up almost all night. They're not sleeping at all. They are literally getting up at 3 or 4 in the afternoon. They're barely having one proper meal in the day. So they're not hydrated enough. They're not drinking enough water. They don't have balanced meals. All night when they are up, they are binging on junk food or whatever is left over, without really looking at a balanced diet approach. Because of the sleep cycle disturbance and the cortisol, which is the stress hormone that goes up with situations like this, it affects the way they think. It causes more moodiness and irritability. It creates problems with basic attention, concentration, focus, and memory. They find it difficulty for decisions or planning. I know so many teenagers who've gained about 8-10 kilos in just about 2.5 months time. With severe decreased sleep and all these attributes, immunity has gone down. They're more tired, more fatigued, no energy, lethargic, no motivation to study or work hard. And of course, all this also affects their gut health. Now, as you know, mental health and gut health are connected. So there's obviously more acidity and things like that. And it is leading to a lot of health concerns and hormonal imbalances with teenagers as well, right? So that's with regards to that. And understanding the reasons also are a lot in a way, because I know so many kids are stuck amidst their board exams. At least the IB boards and the IGCSE boards have declared that they get promoted and they move to the next grade because they are taking their predictive grades. But your ICSE, SSE, and CBSE boards are still, postponed. There are kids who, have 3 or 4 board exams, exam papers pending. Imagine their plight. They don't know whether to study, not study. They're frustrated. They don't know when school is reopening. I know so many families who've spent lakhs and lakhs on their child's education to go abroad. That's also right now at a standstill. There are students waiting to join universities. So literally, I feel, like I said, teenagers are the most affected in all of this. And with all these mental health concerns that is creating havoc with their lives, they also, teenagers being teenagers, are not being mindful about their health. They're not exercising. Like I said, they're gaining weight. They are keeping very unhygienic. I know so many teenagers who don't bathe for 2-3 days at a stretch. This causes bacterial and fungal infections. Skin and acne problems have increased, and a whole lot of, like I said, other hormonal imbalances. so many teenagers are being diagnosed with the onset of diabetes because of the blood sugar levels going up. And of course, like I said, severe sleep disturbances that worsen all of this. So all these aspects, when parents are going through it, I know it's very, very challenging because dealing with teenagers itself is difficult. But I think one has to be very, very firm about certain attributes to health and systems and routines that have to be put into place so that they don't get affected to this point. Then, of course, one also has to understand that, talking about all these aspects, I would like to highlight over here that, when your mood gets affected, when sleep gets affected, there are a few strategies from a holistic health perspective that is known to help. So when sleep is getting disturbed, or even if one of you feel that your sleep cycles are going for a toss, you're struggling to fall asleep, you're tossing and turning in bed for 2-3 hours, and you're sleeping, but you're getting up 2-3 times in the middle of the night, or perhaps you're getting up in the morning feeling like you've not slept well and not feeling fresh, please use magnesium supplements. Right now, there's a lot of research going on where magnesium, in normal magnesium supplements at about 500 milligrams, is known to, create more calmness. It's known to bring down, more, it's restlessness and anxiety. It brings about more relaxation, and it gives better night's sleep. Also, if the sleep problems still persist, you get melatonin tablets also. Melatonin is basically your natural occurring sleep hormone. So for example, say if I have vitamin D3 deficiency, which again is affecting a lot of us because we're not exposed to natural sunlight and outdoor activities, right? So how you take supplements for D3, in the same way you get melatonin, which are natural supplements. They're not sleeping tablets. They don't cause any addiction or tolerance or withdrawal symptoms. And yet you can take it very, very safely, and it doesn't cause excessive drowsiness as well. But it really, really helps, like I said, re-regulate and bring back normal sleep cycles. You get them in most chemists. You don't even need a prescription for it. And there are a lot of lovely imported brands, made. There's a brand called Health Aid UK as well that's freely available in all your chemists, especially noble chemists, that really, really help to bring back sleep. Another supplement that we can all take is omega-3 fatty acid. That is a natural occurring fish oil. So definitely increasing, your diets with fish. You get omega-3 naturally in flax seeds, white oats, almonds, and walnuts. So if you infuse that daily in your diet, it can really, really help, because omega-3 again helps with, cognitive abilities. It's a good supplement for the brain. It helps with focus, concentration, attention spans, and memory as well. Also, like I mentioned, gut health is important, right? So looking after our gut health is either using probiotics. Probiotics is what you get in your curds or dahi at home, yogurt. So have a daily supply of that for your gut health, which really, really helps. And of course, use multivitamins at times like this for our immunity, and definitely choose a multivitamin that has zinc in it. So again, what is freely available right now in the markets and in chemists is a tablet called Zincovit. It's got B3, B6, B12, all your B supplements of vitamins, and it's also got zinc. So these are just a few kind of, natural ways of maintaining health at times such as these. So that is something, if you can incorporate in your diet or as supplements, it will really, really help. Now coming to the end of coping, right? So of course, I'm sure all of you have done your own reading and research, and I think we are done to death with the amount of information overload that we're getting with what to do and what not to do in times such as these. What I have tried to do from a mental health perspective, I've just kind of brought down about 7 points that I would like to share with you, which for me personally are really, really important. I think the first aspect that helps us to come to terms with what is happening is to all the time try and be present in the moment. being present in the here and now. You know, what happens is the human brain is such that we're constantly thinking back of the past, or thinking about things that have already happened. But like I said, no matter what you and me do, we can't rewind time and change things that have happened in the past. And yet, if our thoughts and our mind keeps focusing on that, it sometimes leads to, you know, low moods and depressive thinking. A lot of us constantly, naturally, especially like I said, at times like this, think about the future all the time. Now, the reality of the future is you and me don't know what's going to happen even in the next 1 hour, leave alone the next day or the next month or the next year, right? So constantly worrying about the future is also futile. But with these two aspects of thinking about the past or constantly worrying about the future, the present moment in time gets lost. And I keep telling everyone that if nothing else, this lockdown has taught us to be present, has given us these, you know, the quantum of hours and days to actually spend at home with our loved ones, with our children, with our parents. And that's a blessing in its disguise, in a way. It's the silver lining through all of this, right? Secondly, a concept called mindfulness, which is giving far more thought into everything we do, feel, and say, right? Because, like, for example, whether you're, you know, when you're eating a meal, be mindful of what you're eating, how you're eating. Is it a balanced meal? Are you consuming enough of water or liquids through the day? How many liters have you drunk? You know, are you having enough of fruits and nuts? So that's what I mean by mindfulness. So mindfulness for your body through exercising, mindfulness for yourself. You really, really have to give time out for yourself as well, just to sometimes sit alone and just be with yourself. Mindfulness with relationships, because like I said, like I started off saying today, there's so much of strife and conflict sometimes, and with an increase in abuse, that it's so important to be mindful of what we are saying, how we are saying it, our choice of words, the tone of our voice, our body language, right? All this can lead to better or effective communication and more mindfulness with regards to safeguarding our relationships. So that's what mindfulness means. Third, like I said, collective responsibility, right? I mean, as frustrating as these times are, we have to believe that we are working at home and staying at home to safeguard ourselves, our family members, and our loved ones from contracting this. So if you keep reiterating that concept in your mind that it's for safety of your loved ones with the social distancing, then staying at home doesn't seem all that bad. Fourthly, something that Xerxes brought up in the beginning of today's webinar, that we have to, the key words here are adjusting, adapting, accepting, and embracing these new changes. Like I said, even if we are not tech savvy and we have blocks or mental blocks towards technology and using online banking, using calls like this through Zoom, webinars, now even education, like I said, we have to embrace these new changes. I mean, we can constantly mentally keep getting upset, irritated, angry, and frustrated about it, but we can't do anything about it. So we have to embrace, accept, and adjust. Adjusting to situations such as these in life become very, very important. And of course, like I said, adopting to new ways of life, whether it's at home, working from home, how to balance your home chores, how to balance your children's schooling, how to get with online banking aspects. And like I said, there are plenty of people around who are really, really helpful that can guide you with all of these. Fifth is one, no matter what one says, one has to create a robust timetable and schedule and respect time to balance things out in a day. So balance is the key word. You have to balance your work, your home chores, your family life, your quality time that you spend at home, and very importantly, yourself, looking after yourself. So if there is no balance and no structure and no routine that you set up for yourself, even for simple exercises at home, there are going to be mental health issues that are going to crop up. Sixth point, which is again very relevant, is to connect and communicate. In times like this, we need to reach out, especially when you know that some of our elder loved ones are alone, because the elders in all of this are really, really suffering, right? Because for them, the uncertainty is even far more. Anyways, being over 50 or 55 years of age is a perhaps risk to contract this virus. So a lot of fears and anxiety with the pandemic in itself. I know so many elders who are struggling with payments, with online banking. They're not technologically savvy. So much of added stress and a sense of helplessness, hopelessness, and isolation that set in, because like I said, some of us haven't even been able to meet our own parents or our grandparents because of this lockdown. So connecting no matter what, touching base on a daily basis with certain people such as these and loved ones and your friends and family becomes very, very important. Just a phone call, a text, sharing photographs, sharing jokes, and being humorous can really, really help someone who's feeling low and down. And lastly, what I believe truly, truly in is what I consider as gratitude. At least that has kept me going because I just feel with our fast-paced lives and all that goes on, we take so much for granted. We take the health of ourselves and our loved ones for granted. We take the stupidest and the smallest of things that we have in life. We don't really sit down and mindfully appreciate them. So take this time out to reflect, and you will realize that when you are thoughtful about gratitude, there will be about 10, 20, 30 things that you will feel that is grateful for you, right? So gratefulness or gratitude is something that you have to keep, allowing yourself to think about, to focus on. Because like I said, if you look at all the other stuff that's going on around us, just having food on our table, having a steady flow of provisions coming to us in our homes, knowing that our loved ones are safe and healthy around us, knowing that our children are safe, knowing that education is still going on, and there is a whole world out there fighting this together, finding a cure, a vaccine, hopefully one day. And like I said, we are all in this together, and constantly focusing on gratitude, like I said, really, really helps. So these are the 7 points that I thought are very, very important. And of course, I did mention about exercising. And I don't mean, even if you don't have to have access to a gym or a trainer or, outdoors, even if you're indoors, there's so many things now that you can research upon and do in the, presence of your own house. And that too is very, very important to do. So that brings me to the end of what I wanted to share with you all today. So thank you.
Thank you. Thank you, Zirak. It was wonderful. Very, very informative, and also gives us a lot, not a ray, but a bolt of hope against these challenging times. Just to sum up before I go on to the Q&A, these are, as you rightly said, these are very, very challenging times. And the time to seek help is now, before it's too late, before we go over the hill, so as to speak. And, it has been a challenging time. It has been a trying time for everyone when the lockdown has taken place. And a lot of things can be, you can make it pretty interesting for yourself, I feel. If you, this is the time that you'll find, we are in Mumbai, at least we were caught up in a rat race. No one had time to do anything besides go to work, meeting your social commitments, and doing other things which are required by the others and not for yourself. This was the time you can actually keep for yourself. You can find yourself. You can create a new hobby. You can learn things which you wanted to learn, like the piano. Like I'm learning online chess for the first time. I never thought I would have the time to do it. And interestingly, I have been following Sadhguru on Isha quite regularly in this lockdown period. And he said, if you can improve your life even 10% in this lockdown, your quality of life, every aspect of your life, by just 10%, your whole life will change when things return to normalcy. Yeah. So as you rightly also said, the worst is yet to come mental health wise, because now that the world is opening up, there is going to be a lot of, restructuring in businesses, jobs. While this webinar was going on, I just got a WhatsApp message that Emirates has laid off 600 pilots in one day today.
Wow.
So you are going to have a lot of mental health issues. I think more than the pandemic, mental health fatalities and illnesses will be far more. So we are in for the long haul, and this will take a year, 2 years. Even if you find a vaccine in the time to come, the after effects of this is going to be huge and humongous. There'll be civil unrest. There will be a law and order situation. So we all need to really worry and take cognizance of our mental health and address the issue now. As you rightly said, you spend time with your kids, you bonded with your kids. This time is never going to come back. We have to make the most of it as well. For the businesses, this is the time to innovate. There are a lot of things we have learned as a business house that so much can be done without actually going to office. So many costs are unnecessary. So much travel was unnecessary. We are functioning fine right now, barring that the business has dropped. So this is something where the way we do business, the way we conduct ourselves is going to change forever. And above all, as you rightly said, is the question of developing a sense of gratitude. We are, even in Bombay being the epicenter sort of in India, we still had food being delivered to our doorsteps. We never had a problem, at least the fortunate few of us, of having all our basic needs and necessities being met. So the only thing we can do is pray, develop a sense of gratitude that we are safe till now, and hopefully will continue to be so in the future as well. So once again, thank you very much for that. We now have a little time for the Q&A session. I'll start off with a couple of questions of my own, if you don't mind, and then we leave the floor open and Yazdi can take over. So one of the biggest things is how does, above, as you rightly said towards the end, we are worried about the teenagers, about everyone else, but senior citizens is, first of all, they are more at risk. At the same time, they have been confined to their houses, they have been confined, and they've been restricted. They don't know what to make of it. So how would you how would you guide the senior citizens to live their life? Because see, not that I wouldn't say they have limited time, but they have to make the most of what's remaining of their healthy life. And now we are constricting them from going out, from meeting their friends, from pursuing their exercises, whatever they are. What would you tell them to do?
Sure. So like you rightly said, senior citizens right now are a big challenge. And in fact, we are trying to set up and work and collaborate with a lot of NGOs as well to support them. I think what's really, really helping is because of the slight ease of the lockdown, what we're encouraging is that if we know that the family in concern and the senior citizen has been well within confinements and quarantined in that regard for about at least 2 months at a stretch, we are encouraging families to call them over to stay with them. Because I think what's really, really, we have a helpline also, Xerxes, and it's heart-wrenching to hear some of the senior citizens who are just crying out. I mean, they literally sometimes call us up on the helpline because they don't have anyone to talk to. So, so we're encouraging, like I said, families to take them in for a while and, make them live with them. So that's helped a lot, because now that initially it was the fear of them contracting the virus, but like exactly. I said, the family and the senior citizen is well within the reaches of being isolated for these times and is asymptomatic. That's helped. So in fact, this Monday itself, when the lockdown was eased up, a lot of family members went and fetched their parents or grandparents and brought them home. What is also helping is, like I said, NGOs and helplines. They are actually making calls themselves and reaching out. I think without even seeing it, I think every building society or neighbor has just jumped in to know. So I know so many senior citizens who are clients of mine. They talk about such beautiful stories in the last 2 months of how even neighbors they didn't know would literally leave packages of food or provisions or even sometimes home cooked food outside their door, ring their doorbell and go off. So that was really heartwarming to know. And I think that's what I also meant by collective responsibility. Small acts of kindness, compassion, it makes you feel great at times like this too. So again, we are urging others to do that. And actually when more and more people are being aware of what senior citizens are going through. They are reaching out and doing that. And lastly, like I said, constantly being in touch with them, even if you can't get them home or you don't have access to them. I think even touching base with them and having conversations with them through FaceTime or a WhatsApp video call, because sometimes, just a phone call is impersonal. So when you see someone face to face, you also get an idea of how that person is looking, how is that person feeling. You can crack jokes, keep touching base. I know we're all crazy busy, but sending them photographs, sending them some positive forwards. We're encouraging senior citizens to not constantly even watch too much of television, and the negative news can get to you because, so many times you're bored at home, you're watching news, and all you're hearing or reading is the cases going up or the number of deaths that are increasing. So all these aspects are creating more anxiety and panic, and we've told senior citizens to kind of cut down their time on viewing all these negative aspects of news. And lastly, like I said, just the same strategies I gave you all about ensuring the sleeping right. So basically touching base with them to make sure that there are no kind of warning signs of any kind of mental health aspects. And also being being elders, one can't give them any sedatives or drugs that cause side effects. So one has to be very, very cautious when you treat them and help them, even for mental health issues. So all these natural ways, like I just mentioned to you all before, is what we are suggesting for them as well.
One more before I read out the other participants. Thanks, Zirak. That's quite well taken. How, you see, now we are social animals. We love to interact. We had all in Mumbai had a very hectic social life. It was our biggest de-stressor, so as to speak. Even if you had a bad day, an evening with friends would help a great deal. Now that has been taken away for the last 2 to 3 months, which is, I'm seeing, having a profound effect on many people. They're just desperate to meet up, just talk, have a great evening. You can talk on, we have had Zoom sessions on drinks, but that's not the same, as we know. It's just, it's nowhere near it. You can have the meetings, but you cannot have a social get together on that. Now, how do you propose that things are returning to normalcy? People are beginning to meet slowly, but there's also danger. So how does one now go to the next step? There is sort of anxiety. Friends want to meet, but they're scared and they don't know what to do, or the families want to meet, but they're scared.
So that's a difficult question because, like I said, with the uncertainty of the unknown, we don't really know, right? I mean, so there are two schools of thought here. One is what was proposed in the UK a long while back with regards to herd immunity. They talked about building up immunity, perhaps getting a low variant of the virus and contracting it. But like I'm again saying, that the viruses are supposedly mutating. We don't know what mutations are coming by or what strains are more difficult to eradicate or treat versus the milder strains. We don't even know if there are strains. So what I'm saying is that there is so much of uncertainty with this virus itself that I just feel that if we've come and pulled along for 2.5, 3 months, there is no harm in waiting. When I use the word waiting, I mean being still as sensible and safe like we were. Because if you look at the predictions and you look at the trend, they are saying that we've not even reached our peak. So the actual peak is supposed to be reaching somewhere in July and August. So, all I can say is that we have to, err with caution as far as possible, unless you are very, very, like, for example, I know certain neighbors who live across us, and we know for a fact that they haven't gone out, they haven't met anyone, they've not gone to work. So when you know people in close proximity, people who are walking distance or perhaps in your building, etc., who've been quarantined with you, for those same durations of time, then it is relatively safe to meet up and, you can get your social interaction with that. But otherwise, I still don't urge, because Xerxes people in their own homes, I know about 5 people who've not ventured out at all, who only got their provisions home and they've still tested positive. So that's how contagious this virus can be. So one has to exercise caution, I think, at least for the next month.
Thank you. Next question is from Xerxes Dastur, and I think it hits home very hard even to us. How do we control screen time for young kids? It's getting very difficult, and we all seem to be just tired and are giving in ultimately because you're restricting them to move out. And
no, you can't. You have to see again. So basically, there's a group of us as doctors as well. We even have a pediatric ophthalmologist who we are consulting right now, who's doing a lot of research, because I think a lot of teenagers and children are complaining of more fatigue, irritable moods, lethargy, irritation, headaches, watering of eyes, or itchy eyes. These are the main 5-6, I think, symptoms that are being addressed right now by ophthalmologists for overusing of screen time. So the eyes and the vision, there is going to be an amount of fatigue that sets in. So one, just, I mean, like how you would not encourage your kid to smoke, you would definitely come down hard or be a bit disciplined and firm. So I'm not saying we need to shout, scream, and fight, but you have to have logical times and breaks that you have to give in. Like we know exactly, for example, when there's school hours are, when there are online work, there's online work or courses, we know the duration of time there. You have to insist that, say, for example, even both my kids have online schooling and sometimes it goes on for 4 or 5 hours. Now we clearly give them a break. I mean, when I say break, no screen time. So the iPads go off, the computer goes off in those breaks, no television, no substitute again for screen. You see what's happening with teenagers is they are done with their online schooling. They're going on their mobile phones. They're browsing on social media there. Then they are finishing with that. And then in the evening, they're watching television with their parents. So round the clock, there is screen time happening. So like I said, giving breaks, simple things like policies at home, like on the dining table, for example, during breakfast, lunchtime, dinner time, definitely no screen time, no television or no phones allowed. And I think it is very important to role model. I mean, I realized that with my tiny 6-year-old, she made me laugh almost because I was constantly berating her and saying, don't keep looking at your iPad and come on, give yourself a break. She just turned on and told me that, but daddy, you're all the time on your phone, which is true because I'm working on my phone. I'm constantly responding to, SMSs or patients calling in or emailing. And so it's also role modeling, right? So when we look at these breaks, when we look at giving ourselves time out, I think we have to factor it in as a culture across all of us at home.
Thanks. That's a good one. Then we have from Miss Commissariat that she says that you have suggested to bring elderly family members to their homes now that who cannot manage on their own, etc. But there are people who are already 65 plus cannot step out of their homes as per government or advised not to. So she's asking, how can I bring my 95-year-old mother to my house? And with no help or with no facilities to bring them. So is there a sort of a chat, I mean, a forum or a service which provides these services?
No, there's no service to really. So basically right now, there is no lockdown because before, when there was an actual lockdown, you could not just drive out and get people home, etc. So one or two things is, like in most buildings and societies, they are allowing for even part-timers to come in. So one is you have to understand what your society building rules are. Two, you have to be sure as a family that you guys have been completely safe. So if you know that for the last 2 months or so, you've taken every conceivable precaution at home with staff members and other family members, and you know that you all are all asymptomatic, then you'll have to get out. And you can, there's no public transport still available, but if you do have access to a car or a driver, then there's no harm in taking that step and plunge and bringing your 95-year-old back home.
Thank you. Okay, so I think that we are quite done. There are no more questions. Thank you very much, Zirak. Really appreciate it for sparing the time. I think you have enlightened those who have attended here very well. We really hope that we can come out of this situation unscathed.
Sure.
Yeah, I'd like to request our President, Mr. Temtan Dalal, to please propose a vote of thanks, and then we can call it a day. So thank you, everyone.
Thank you, Xerxes.
Thanks, Zirak. Mr. Dalal, over to you, please.
Dr. Zirak, behalf of the World Chamber of for the lovely webinar on COVID and lockdown glows. The slide explained was very easy to understand in a manner. I think all the have really liked your wonderful strategy.
I think we have an audio problem perhaps with him. Yazdi or Ave, can you?
Yeah, I think his connection is not smooth.
Okay, so perhaps then Aspi would like to fill in and give the vote of thanks, please. And Aspi, please go ahead. Our CEO. Yeah, Aspi, you have to unmute and then do it, please.
Zaxis, you complete it. You go ahead, Zaxis.
Please go ahead.
Go ahead, please.
Please. No, please. It's better.
Yeah. So, Dr. Marker, thank you very much for this webinar. It's been a very wonderful webinar, very useful tips given by you. And I'm sure that all of us listening to this are very excited about your talk. And if some member wants to send you a question later on, is he allowed to do so on your email?
Yes, sure. I will share my email address with Zoxis, and anyone can email me and I can give you details. Like I said, we even have a 24/7 mental health helpline. Okay. And it is in English, Hindi and Marathi, and we have a whole team of psychologists who are working really, really hard day and night, help and assist. So if there are any kind of queries and questions, even in the middle of the night, it's good to have access to that helpline, and you can call in. So always reach out if you ever need to reach out and ask for help.
Thank you. I already have your email ID, Zirak. I will provide it to them. Thank you very much once again for everything. Really appreciate it. Yeah.
Thank you so much. Thank you all.
Zaxis, why don't you type it in the chat box so that it becomes easy?
Sure. Can I do that, Zirak, with your permission?
Absolutely. Absolutely.
Okay. I'll do that. Thanks.
Okay. Take care, Zoxis. Thank you for having me on board. Thank you for all the support.
Thank you.
Bye-bye.
Bye-bye.
Thank you, Zirak.
Thank you. Thanks, Aspi. Thank you.
I'm not able to access it right now. Yazdi, I don't have it with me. I'll send it later on to this thing if you don't mind.
Send it to Aspi. Yeah.
Yeah, I'll send it. Thank you. Thank you.
Bye-bye. Thank you and good night. Stay safe.